Assalamualaikum everyone and a very warm welcome to our webinar. My name is Fatma Shaukat and I am a BS Public Health student at the University Institute of Public Health, the University of Lahore. Today I have the pleasure of being your moderator for today's essential webinar, which is brought to you by Public Health Awareness and Training Center and the University of Lahore. As per registration, we have participants from all Pakistan and from different universities like from the University of Lahore, Punjab University, University of Sindh, Dove University, HSA, and many different. So today we are here to discuss an extremely important topic, scabies in shared spaces, understanding predictors among hostel students. So it is my great honor to introduce our distinguished speaker, Ma'am Tallat Anwar Faridi. She is an assistant professor, public health specialist, and in vector-borne diseases at the University Institute of Public Health, the University of Lahore. Ma'am, it's over to you. Thank you so much.
Good evening. Assalamu alaikum. Hi everyone. Hope you are doing well. Today I am Fatma. You have told me about me too much. Okay. No, I will. I am excited to share some insights about the scabies. I hope and I believe it will be valuable and more practical for you. Thanks for joining. Let's get started. Scabies is a common but often misunderstood skin condition, right? The topic of my presentation is scabies in shared spaces, understanding and predictors among hostel students. Right? Next, please. Scabies in general. Scabies is a skin infection caused by sarcoptic scabies, which is a parasitic infestation. Sarcoptic scabies or the itch mite is a parasitic mite found in all parts of the world that burrows into the skin and causes scabies. Human become infested by sarcoptic scabies, while other mammals can also be infected by different varieties of mites, and it may be cause temporary itching but not true scabies. So first of all, I would like to have some brief introduction of this. Fatma, जरा इसको सीधा करें. This is a classification of mites, scabies mites. The scientific name is Sarcoptic scabies, which is a parasitic infestation. Parasitic mites class belongs to class Arachnida, family Sarcoptidae, genus Sarcoptes, and kingdom Animalia. Order is Sarcoptiformes. Phylum is arthropods. As you know, arthropods are eight legs insects. Something about I would like to tell you something about the mites, which is a sarcoptic scabies. It describes that its size is very minute, varied habitats, developmental stages are different, distinct morphological characteristics that differentiate from the other, such as presence of four legs of some other insects. It is different from the insects, as the presence of four pairs of legs and unique body organs. A group of insect-like organisms, some of which bite or cause irritations to humans. Some mites parasitize animals, including man. Others are others are sarcoptic. Some feed on plants and may prey on insects and other arthropods. Mites have bulbous body, round, pill-shaped bodies, classified as arachnids, and have eight jointed legs. Their size varies by species to species, but most mites are usually invisible to naked eye. Its size, female size is 0.3 to 0.45 inches in length, and wide is 4. The female mites are smaller, measuring about 0.2 to 0.24 long. Next, please. 25 each day and then die. The new mites hatch from the eggs in 10 to 15 days. It will make a tunnel on the skin surface and go into the adults. The mites cannot survive on the human body for more than 48 to 71 hours. It's very slow in movement, ability to survive only a shorter time outside the host, a rapid reproduction once inside the skin place. So please listen carefully. Mites are burrows in the skin, and it makes a tunnel over here and then grow into adult mite. So the life cycle of scabies is adult mites deposit eggs as they burrow into the skin, and eggs, and then eggs hatch into larvae, and larvae then into nymph, and in the short burrows called molting pouches. Madam, back pe jaye. Molting pouches. Molting occurs after the male penetrates into the molting pouch, and the adult females and impregnated females again extend their molting pouches into the burrows, laying eggs. Next, please. This is the life cycle of scabies. The adult might, a pregnant female might transfer to the skin of the uninfested person. Might travel skin surface at the rate of 1 hour per minute, seconds, seeking a burrowed site, depositing 2 to 3 eggs only. These eggs then converted into a developmental stages, larvae, and the nymph and adult in within a 10 to 17 days. And then adult migrate to the skin surface, and then their mating started. The male dies quickly and female penetrate the skin to repeat the cycle. So it's a skin infestation due to the mites. Next, please. Symptoms of scabies. As you know, scabies is a common but often misunderstood skin condition. It's a skin infestation. The mites that burrows into the skin and makes a tunnel over here in the upper skin or epidermis, and it will take 2 to 3 weeks, and then go into adult mites, and there will be allergic reaction started. So I will discuss something about the some symptoms of the scabies. Main symptoms of the scabies are due to the body's allergic reactions to the mites and their waste. Symptoms include itching, widespread rash, often worst at night, which occurs mainly between the fingers and the waist and armpits and wrist, navel, and the elbows. It usually affects both sides of the body alike. Scabies mites can also live on the surface, such as clothing, towels, and furniture, for up to 3 days. The rash does not correspond to where the mites are located on the body. Next, please. It will appear as a scaly skin flakes. Mites eat skin flakes in the the epidermis of the skin. Chapped skins, irritation caused by friction, swollen classical scabies. It's a very common form of scabies. Common type has fewer than 20 mites all over the body, and yet this shows that classical scabies are in which the less number of mites they are infested the skin upper surface of the skin. Second is, next please. It looks like rash. The crust is Norwegian scabies, a rare type of which may be seen in immunocompromised individuals, can have thousands or millions of mites, causing a more severe reaction in the skin. It develops due to insufficient immune response in the host. The mites can survive in the environment for 7 days, therefore can easily be transmitted from clothing, bedding, and upholstery. It can cause large pink, white, or gray crusty patches anywhere on the body. This type of scabies is extremely contagious. Next, please. Next, please. See the diagrams. Third is nodular type of scabies. This type is more common among children and affect their genitals, groin, and armpits. The raised bumps can still be there long after mites are gone. The less common chronic form of scabies, where persistent intensely itching reddish brown nodules develop, often in areas like genitalia, groin, and armpits. Next, please. There are three types of scabies. One is called classical, which is normal. There's a few numbers of mites, less than 20, or maybe 20, more than 20, not too much. Infestation of the mites occur in the infestation in the skin. This is a classical type of the scabies. Norwegian scabies is a crusted scabies. The Norwegian, because it in the Scandinavian countries it is more prevalent. That's it is very crusted. It is caused in the immunocompromised patients. And third is a nodular scabies, which is which occur in the groin and armpits and groin parts. Transmission about this factor from an invested who is already has scabies. So direct skin to skin contact with a person who is infested with scabies, approximately 10 minutes uninterrupted skin to skin contact. How rapidly it transmits. The mite cannot jump from person to person but can crawl from one individual to another when there is a skin to skin contact for a short period of time. One holding example, when you holding the hands, classical scabies on average the mites can arrive in the environment for 24 to 36 hours, therefore can be transmitted from clothing or bedding. Next please. By direct prolonged skin-to-skin contact with a person infested with scabies, bathing, back rubbing, and applying lotions. By indirect contact, sharing clothing, towels, and bedding. Therefore, wash all clothing, bedding, and towels used by the infested person in the previous 72 hours in hot water and dry these items in a hot dryer. Vacuum all carpets, rugs, and furnitures and discard the vacuum bag as well because it is highly contagious. Put anything that cannot be laundered into plastic bags for at least 72 hours. Next, please. So, like this, wash the clothes, bed linens, because it is highly contagious in hot water. Next, please. Who is at the risk of for infestations? People who live or work in institutions like hostels, jails, prisons, home for the developmentally disabled persons, skilled nursing facilities, nursing home, people who live or work in crowded conditions or immunocompromised, elderly and debilitated individuals who are weak immunity. Next, please. Clinical manifestations of scabies are it forms rash or small red bumps on the skin, papules, pimple-like rash, vesicles, blister-like rash. Intense itching, especially at night over most of the body. Rash and itching are caused by hypersensitivity reactions, allergic response to the mites, eggs, and feces, which are lying under the burrow into the skin surface and in the form of tunnel. Tika burrows tunnels may look brown or black in color. Track marks, thin thread-like lines show in the skin. Next, please. Where do scabies might live on your body? The mites live in the folds and cracks of your skin. Folds in between your fingers and toes, skin folds under breast, folds in your thighs and genital areas, bends at your wrist and knees, the area around your waist, under fingernails, under rings, watch bands, and bracelets, the area around your nipples, lower abdomen, and in buttocks. See the diagram where it lies in the buttocks, in the armpits, the folding area, and the hands folding fingers. Next, please. It looks like this. Scabies is 8 legs arthropods, right? It lays eggs, and then this legs eggs are laid into the skin, upper surface of the skin. It makes a tunnel-like appearance. This tunnel is the best diagnosis for this that this person has a scabies, right? Or tunnel is very or the female and male dies over there, and then the next cycle starts, and so the mites will grow, and the itching will be started in the skin by allergic reactions. Next, please. See the scabies fingers, elbows, and feet. How it looks like dark brown, light brown, shaded, makes tunnels and rashes and bumps, and the folding area of the body, finger webs, and diagnosis of next, please. Diagnosis of scabies often misdiagnosed because of clinical evaluation, clinical signs and symptoms. We can check it from the skin scraping, microscopic demonstration of mites ova and fecal matters obtained from the skin scraping. This method is very, I think, very important. We can test the scabies patient or diagnosed by this method is skin scraping. You will see the microscopic demonstration of the mites and ova and fecal matters are clearly seen. So a negative skin scraping does not rule out scabies infestations. Next, please. Treatment options can be, right? Because it's a skin infestation or it's a parasitic skin infestation. So topical scabicides, lotion or creams are used. The scabies, as the name shows, scabies, that is scabicides mean to kill the scabies, to kill the mites. 5% permethrin creams are available in the market. You can use it. Linden lotion or cream apply कर सकते हैं. 10% cotoneton lotion or cream use की जा सकती है. They are available in market. Sulfur ointment or other alternatives in special cases में doctor as per recommendation by the doctor. Benzyl benzoate lotion you can use it. Antihistamines or soothing lotion to help and relieve the itching. Because itching is so rash and bumps and vesicles are developed and it's so contagious. It develops very quickly. Next, please. Oral antiparasitic ivermectin therapy uses single drug injections every 3 months to treat it. This drug kills the mice while they are still in their eggs. So there is no need to repeat the cycle, right? Ivermectin therapy used की जा रही है आजकल और एंटीबायोटिक्स if you have any infections अगर आपको इन्फेक्शन है तो आप एंटीबायोटिक्स ले सकते हैं अगर स्टिल आपको एंटीपैरासिटिक इन्फेक्शन है देन आप ivermectin थेरेपी यूज कर सकते हैं इज अ सिंगल डोज दे सकते हैं देन डोंट रिपीट द साइकिल ओके स्टीरॉयड क्रीम्स भी यूज करते हैं फॉर रेडनेस एंड स्वेलिंग के लिए यू कैन यूज any steroid creams regarding of course is scabicides. There's a currently no commercially available vaccines for scabies anywhere in the world. It is treated by medicated creams or lotions. That there is no vaccine for this skin condition, skin problem, and it is treated with the medicated creams, lotions, and oral medications to kill the mites. Next, please. Next, please. Applications, how to apply the scabicides. First of all, take bath or shower, dry the skin thoroughly before applying scabicides to kill the mites. And this can be used in the scabies patients. Medications should be massaged into the skin from below the chin to the sole of the feet. Right, fingernails and toenails should be clipped and scabicide applied under nails. In infants, toddlers, the elderly, or the immunocompromised head, forehead, temples, and scalp require application of scabicides. Next, please. Contact with the eyes and mouth should be avoided. If scabicide is washed off during the hand wash, toileting, or perineal cares, it must be reapplied to that area. Reapplied or it will be to that area, right? Apply medications to the skin and wash off of after 8 to 14 hours can be applied at bedtime and washed off in the morning. Knee takes after 8 to 14 hours after application. Itching may persist for 1 to 2 weeks following successful treatment. Next, please. Fatima, next. Who should be treated for scabies? हम किनको treat करेंगे scabies के लिए? Anyone diagnosed with scabies? Of course, persons who have a close prolonged contact with the infested persons should be treated. I hope you understand who should be treated for scabies. Any diagnosed with diabetes, with the scabies, persons who have close prolonged contact with the infested persons should also be treated, right? Patients, household members, people who live in the close and crowded conditions, employees, co-workers, sexual partners, friends and classmates, and roommates, infants and children. Children have a lot of close physical contact with their caregivers or friends or family members. People who are all elderly, especially those living in the nursing homes, Healthcare workers who care for people are not aware they have scabies. So people who are sexually active or in have their weak immune system. Next, please. Epidemiologically, अगर देखा जाए तो scabies affects more than 400 million people around each year worldwide. That is 400 million people each year worldwide. It's generally more common in tropical areas that lack medical resources, but but can still occur anywhere. Scabies outbreaks in US and similar countries tend to occur in places where people have share living spaces with like nursing home, extended healthcare facilities among different communities. Different epidemiological distributions are reported like the for the scabies. The highest rate is found in the Pacific Island countries and in many other tropical countries, including Africa. The disease is known to be quite prevalent in Pakistan. Several scabies epidemiological studies have been carried out in different areas of Pakistan. Here are some reports available for 1995. Mein Bilkis have done research on this subject and Anwar et al. In 2006, but the epidemiological data from many areas is still missing. Next, please. Where scabies outbreaks occur: nursing home, detention facilities, childcare facilities, homeless shelters, or encampments. Local or state healthcare departments may be able to provide guidelines for preventing and controlling scabies outbreaks. Next, please. What are the scabies predictors? Following are the main predictors have been found from various past studies based on the scabies. As you know, researches are going on in lots of the medical issues and medical conditions, and of course, scabies is various past studies based on the scabies. I'm showing this predictors according to the references. Research has been done, and this shows that scabies in relation to the hostel life. Uh, Hostel life may become as a predictor. Family size, scabies in relation to their family size, scabies in relation to their house characteristics, presence of domestic animals in the house, general health conditions. These are the scabies predictors. Cleanliness, sleeping behavior, bathing frequency, how many times you bath in a week, changing of bed sheets, how many times you change the bed sheets, exchange of clothing, and headlights infestations. So we are discussing here the scabies in relation to their hostel life students, for hostel life students. Scabies predictors are hostel life, family size, house characteristics, how many rooms in the house. Of course, if there are one room in a house, and most of the siblings are very closely and living in a very crowded conditions, or have domestic animals or sleeping behavior. It's also a predictor, bathing frequency, and exchange of clothing and changing of bed sheets. Next, please. Next, please. Scabies predictors are these predictors were studied through various surveys. Out of these variables, some emerged as having some epidemiological significance. They included that these researches included that these bed sharing and presence of red lice infestations are scabies predictors. Observation concerning bed sharing as a risk factor in agreement with the Hassan et al. Have done the research in 1979, who reported that most of the infected children shared their beds with other family members. Similarly, 65 to 5% of the scabitic had infected sister or brothers. Likewise, Shannon et al. 1971 have also emphasized that the importance of sharing of beds by children in the spread of scabies. Chostio in 2000 reported reported that the association between the scabies and pedigrees is not yet found, and difficulties in management have returned both of them to limelight. But both scabies and pediculosis are ubiquitous, contagious, and debilitating parasitic dermatosis. Next, please. Next, please. Link of this is the link of my publications on scabies. Please do open this PDF. You will see the conclusion of my research is the research was it's just overcrowding. Scabies spread through overcrowding and frequency of less number of rooms in sharing of beds, clothing, etc. This is my research. Next, please. Next, please. No, but I will recommend the preventive recommendations for this. The boarding schools or hostels need to limit the density of dormitory habitants,
Just wait.
right? Organizations, schools, colleges, universities need to understand that the residents should be able to have ample space between them, therefore have enough distance from each bed. So arranging sleeping in beds would be back page, please. Please back page. Arranging sleeping in bunk beds would be an option if the space is limited. So there should be a regular health examination in hostels, especially on some of the most contagious diseases. Next, please. Infection should be identified as early stage of infection. In a first, the infested person would be largely liable for the first month. Symptoms would be progressively worse after approximately 6 weeks, in which patient would suffer itching that intensifies at night, then become almost unbearable after 10 weeks. Regular attention in students' slightest symptoms should be able to prevent further development of the disease transmission within this risky population. Next, please. Sensitized persons would develop symptoms and regions much rapidly, even within 24 hours. Therefore, treatment could be performed faster if the disease is noticed earlier. 5% permethrin topical cream is the drug of choice for scabies due to the tolerance and low toxicity. Next, please. So cream is applied all over the body for 12 hours before washed off. Application is repeated after 1 week time interval. All contacts, in this case, roommates or slides, should be treated simultaneously. Caretakers or school nurse or guardians or administrator of that hostel must supervise the treatment to ensure safety and correct use of this scabicides. Incorrect use of scabicide would trigger the resistance to all toxicity. Next, please. Next, please. Preventive recommendations is students diagnosed with scabies must be isolated at a quarantine in separate rooms to avoid contact or further transmission to the students. All beddings, clothing must be washed in 50 degrees C water, soaked in boiling water before hand washed, mattress dried under the skin, and room cleaned thoroughly with disinfectants. We recommend the use of hand gloves when handling patients, cloth, mattresses, and linens. References are given. Next, please. Next, please, Fatma. Okay, hostel students as well as the high risk population need to be exposed with the knowledge on regular basis. One strategy is involving hostel mates who have suffered from scabies to share their first-hand experience. So eventually, proper education will hopefully raise the awareness and increase students' practice towards disease prevention. इसको इस पे आपको प्रॉपर एजुकेशन देनी एंड अवेयरनेस देने होगी स्टूडेंट्स को or any facilities, healthcare facilities, or any place where the students or persons are in more than numbers. So hopefully raise awareness and increase students practice towards prevention. उनको पूरा practice करना चाहिए ताकि इस disease से हम कैसे बचे. Next, please. Next, Fatma. Prevention, early detection and treatment and implementation and appropriate isolation and quarantine and infection control practices are essential in preventing scabies outbreaks. Institutions should maintain high risk of suspicion that undiagnosed Undiagnosed skin rashes and conditions may be scabies, even if characteristic signs or symptoms of the scabies are absent and no itching. New patients, residents, or employees or hospitals screened thoroughly, carefully, and evaluated for any skin conditions that could be compatible with scabies. The onset of scabies in a staff person who had scabies before can be early warning sign of undetected scabies in a patients or residents. Where there is a concern for scabies in a person, the skin scraping should be obtained and examined carefully by a person who is trained and experienced in identifying the scabic mites. Appropriate isolation and infection control practices, gloves, gowns, avoidance of direct skin to skin contact should be used when providing hands-on training, hands-on care to patients or residents who might have scabies. Next, please. Uh, next, please. Please back to reviews. Last में होंगे scabies is okay. Next. Scabies is a worldwide problem. What happens most often is in crowded to tropical areas, particularly in under-resourced countries. But it can affect people of all ages, races, or economic status. It has nothing to do with how clean or hygiene you are. Scabies is treatable but can be hard to get rid of completely. Certain forms of scabies are harder to treat, such as the crusted form. In addition, you might need more than one round of treatment to make sure all the mites are gone. Next, please. So the slogan is treat all, stop scabies. यानी आप जो जब आपको स्केबीज हो जाता है तो आपने बाकी जो रेस्ट ऑफ द सिबलिंग्स और रेस्ट ऑफ द क्लासमेट्स या हॉस्टलाइट्स हैं उन सबको ही ट्रीट करना है साइमल्टेनियसली with this treatment. Stop scabies, treat all, stop scabies. Scabies spreads fast and treat faster. One case, treat every contact. No vaccine, only teamwork. Break the itch, break the spread. Scabies ends when everyone treats. Thank you. Now we these are the references.